It's Super Bowl week, friends. This Sunday is a day of food. And for a lot of us, it's things that we don't normally eat, right? I'm here to tell you, you've got this. Refer back to the episodes called How to Cheat and Talking Turkey for tips to navigate this day of eating. And for our members this week, you'll be receiving this easy and delicious recipe for spicy avocado yogurt dip. It's literally minutes to make. You can bring it with you to your Super Bowl party with veggies to dip. You have something that's made just for you, and no one will know it's good for them. Plus, with this day of eating, for a lot of people, indigestion follows. Our members are also getting the lowdown on prebiotics and probiotics, of course, with a discount. Finally, everybody, keep an eye out on Facebook and Instagram for details of my next 12-week phone group, which starts February 11th. So, if you want this perfect Super Bowl recipe, the spicy avocado yogurt dip, and the prebiotics probiotics article, become a member. Go to glow.fm/salad with a side of fries to join. It's $10 a month for weekly recipes, a monthly article, extra discounts, plus access to live Q&A sessions. Yes, all of this for less than the cost of one Starbucks coffee per week. It's your connect to level up on what you're getting from the podcast for a super affordable price. So head over to glow.fm/salad with a side of fries to start your membership now. It's seriously easy, like 3 clicks easy. And then you'll be set up to tackle Super Bowl parties and more. Welcome to Salad with a Side of Fries. I'm your host, Jenn Trepeck, talking wellness and weight loss for real life. We're here to clear up the myths, misinformation, bad science, and marketing to teach you how to eat and how to cheat. Are you ready? I'm having salad with a side of fries. Hey friends, welcome back to another episode of Salad with a Side of Fries. To get us started, here's a note from our partners for this episode. Lumiere de Vie Skincare was founded by Amber Ridinger McLaughlin in response to her own experience of mere marginal results from countless costly creams. She realized the revitalization of her youthful skin could only occur if she developed products herself. Working closely with beauty scientists and exploring the most advanced ingredients derived from the earth and sea, Amber created Lumiere de Vie, the next generation of skincare. The extensive line of luxury skincare products is designed to address all skin types and concerns, including uneven texture or tone, dryness, and fatigued skin. With the highest quality natural ingredients and powerful formulas that help heal, soothe, moisturize, and protect, Lumiere de Vie acts as first aid for your skin. The result? Rejuvenated, luminous, beautiful-looking skin. To try it yourself, text the word SKIN, SKIN, to 844-947-4846, and you'll receive the link and a coupon code for 10% off. So guys, it's winter. Colder outside, heat pumping inside. We have to replenish the moisture in our skin, and I really, truthfully, would not go a night without the Lumiere de Vie Intense Rejuvenation Cream. I feel like I'm at the spot every time I put it on, and this is going to be your go-to nightly moisturizer. So you definitely want to try it. Simply text the word SKIN to 844-947-4846 to get Lumiere de Vie Skincare and a code for 10% off. This is a toll-free number. Standard text and data rates may apply. All right. So as always, I'm your host, Jenn Trepeck, and today we are continuing to learn about different modalities. And I'm super excited for today's guest. So he was drawn to chiropractic care due to his fascination with and respect for the body and its ability to heal and perform without having to use drugs or surgery. He then became a chiropractor in 1999 after graduating cum laude from Life University in Georgia. Life University's purpose is to give, to do, to love, to serve out of one's abundance, which is very much up our alley here. So he's also a fellow at the International Chiropractic Pediatric Association, a family man, a skier, soccer player, and musician. I know you play guitar.
Yeah, I do.
So it's my honor to introduce you to Dr. Robert Shire. Welcome, Dr. Rob.
Hello, Jen. Thank you for having me.
Yeah. So share with everybody a little bit more about just your background and how you came to chiropractic care as your specialty.
Well, I started off in my professional life in the jewelry business, working with my family, my dad, my sister, my brother. And I did that for about 5 years and found it to be not my calling, let's just say. And my wife, of all places on our honeymoon, asked me some pretty challenging questions about if I liked what I did and if I saw myself doing that in the future. And to answer honestly, I had to say no. And of course, that begged the question, well, what do you want to do at this age? And I had no idea. I had no clue. So she suggested I come back to New York, go to NYU to the Career Counseling Center, and try to figure that part of my life out.
That's really good advice.
It was very good advice. So I did. I came back and I did these wonderfully insightful tests called the Myers-Briggs.
Yeah.
And get a little insight into what I'm good at, what do I like, what am I not good at, what do I not like, to narrow down, what it's going to be. And I literally discovered chiropractic by reading through a book and checking off all the things that I read. And then it sort of seemed like the universe began to conspire with me because on our floor where our offices were was a chiropractor, Dr. Peter Lawrence. And he could not have been more welcoming and warm when I brought the idea of becoming a chiropractor myself. And he mentored me. He guided me down to Life University and supported me, and morally at least, not financially.
Yeah, right. Sure.
But yeah, it was great. And about a year after we got married, we set off on a journey down to Atlanta to embark on this thing called chiropractic.
That's so awesome. So I want to dive into this with everybody. So chiropractic care is really about like the skeletal structure, right? Like bones and alignment. So how does that translate into what drives people, I think, what drives people to a chiropractor, which is mostly like muscular pain or like nerve things, right? Like how does that translate?
So chiropractic is actually much bigger than skeleton, muscles, and nerves. Chiropractic really is about life.
Okay.
And the reason it's about life is because we are primarily working with your spine, which is the bony framework of your nerve system. And if you go back to your days of anatomy and physiology, you know that the nerve system's job is to control and coordinate all body function. Right. Every single process that goes on in your body, from cellular function to your reality to your immune system, is controlled to the nerve system. So if there's any kind of stress or interference to that system, your body's not going to work right. And that can manifest itself in a variety of different ways. Yes, sometimes it's back pain, sometimes it's neck pain, but oftentimes it could be headaches or digestive problems or, breathing troubles or even sexual dysfunction, even sometimes difficulty getting pregnant. And we can get into more of that in a little bit.
Yeah. So I have to ask this because it's something that I think about all the time. So typically when somebody goes in for an adjustment, right, like maybe you're adjusting their back or their feet and like in our mind as the patient sitting there, it's sort of like, okay, you're cracking my back, you're cracking whatever, right? So how is it that that's good, but like cracking your knuckles is bad?
Well, the cracking of your knuckles being bad, I think, is something that we've adopted.
Is it true? Even?
Not really. Okay. Not really. That's a wives' tale. You're going to get arthritis. That's not true. So if it gives you pleasure to crack your knuckles, knock yourself out, have a good time. Because your knuckles are at the end of your fingers. There's not a lot of significant, important things going on there. But if you do that with your spine, that could be more problematic. So you want to leave that to somebody who's qualified and trained to work on that, like a chiropractor.
Right. Well, okay. So that's my next question, which is like, a lot of people crack their own neck or crack their own back or like I'm one of those people, like chiropractors have described me as like one of those Gumby people where like I'll just sit up straight and my back cracks like it just did right now as I change my posture. How do you know that it's going into place versus out of place?
All right, so let's back up a second. So the noise that's created when we move and you hear a popping sound isn't really an adjustment. It's a cavitation of the joint that happens naturally. That's a release of gas and fluid in the joint, and that can happen just getting up out of bed. An adjustment is a specific maneuver delivered by a chiropractor to get back into motion areas that are not moving correctly, that are stuck, that are fixed. We call that subluxation. That you're probably not going to get on your own. And that need or desire to crack your neck or to adjust or to manipulate yourself is usually your body's trying to tell you something. Your body's trying to say, hey, there's an area of my back that's not moving, and I really like to have some movement in here because motion is life and life is motion. So that's a good time when you want to go to the chiropractor and make sure that everything is moving properly.
I love that. Motion is life and life is motion.
Yeah.
Amazing. So with that then, right, what might somebody be, I think typical things, right, are the back pain, the neck pain, but what might somebody be experiencing where it's like, no, like what you need is a chiropractor?
So it's kind of like, how do you know you need a dentist? Right? You could go to the dentist if you have tooth pain, right? But most of us go to the dentist for a checkup, right? To make sure that things are healthy, that your gums are healthy, that your teeth are healthy. And then you're going to go back for regular maintenance care, cleanings, to make sure that they stay that way. It's the same thing with your spine. There are many things you can do to keep your spine and your nerve system healthy, including exercise and eating right and making sure to drink enough water and maintaining your stress. But making a regular visit to your chiropractor is another way of making sure that things are working properly. So how do you know you need a visit to the chiropractor? Most people arrive because they're in some type of pain. They're unable to do something. They're restricted in some way, shape, or form. So they think, oh, who should I go see? I should go see a chiropractor. Right. But the reality is that if you've got a spine and a nerve system, you should probably make an appointment to go get your spine checked.
So every human on the planet.
Every human, every mammal who's got a nerve system too. We could talk about animals too.
Yeah, totally. So a friend of mine actually was going back to school to be a vet, and she had to start in all the human medical classes.
Yes.
Anyway, what for your practice, what's sort of the most prevalent complaints or symptoms that you tend to treat?
So there's a lot of that. I would say most people are, working at an office, sitting at a desk at a computer for too many hours, and their posture suffers. So their neck gets tight or their lower back gets tight. So we work with clearing that out, but more importantly, we work with identifying how to mitigate that so that doesn't have to come back so frequently. Whether it's standing up or getting up out of your chair and stretching or doing some movements, but sitting. The people who sit a lot tend to have a lot of neck and back
Sitting's
troubles.
the new smoking.
Sitting is the new smoking, exactly. But I also see athletes and musicians. A big part of my practice is pregnant moms who suffer tremendously with back pain and neck pain. And oftentimes, if their baby is not in the correct head down position, that is something that chiropractic helps with as well, which we can talk about.
So interesting. So was there, what was the most challenging case you've ever had? Or was there somebody that, you really weren't able to help? Would you do it differently now? Just curious.
Yeah. What I love about what I do is that every case is different. Every person is different. Every circumstance. So it's like a puzzle, trying to figure out where is this person not functioning properly? What can chiropractic do, if anything, to help them restore natural function so their body can heal itself? Because ultimately, that's what chiropractic is working with. It's the body's own innate, inborn healing system that works at the direction of the nerve system. So again, if there's interference in the nerve system, the healing is going to be interfered with. Our job is to clear that out so that everything works properly and you can heal naturally, preventing medications and surgeries and so forth. Do you think, no, it's not, do you think that we sort of start in this alignment and we knock ourselves out of it through the life things we do? Or what causes all of this misfunction? That's an awesome question. The short answer is stress. The longer answer is that under that umbrella of stress, there is physical stress, biochemical, and emotional stress. So under physical, let's say you have your macro and micro stresses. Macro would be like an accident, an injury, a trauma, whiplash, something like that. Micro stresses are the daily occurrences. It's how you're walking, how you're sitting, how you're sleeping, how you sit at your desk, how you carry your posture or your bag. Those daily kinds of things can wear down the body. Biochemical stress is the things that you eat, how your body digests or doesn't digest those things that you eat. Not having enough water, those can cause stresses to the system, which can then reflect back to the spine. And probably the biggest one, which might come as a surprise or maybe not to many people, is the emotional cause of stress. Our minds are connected to our bodies, and when we are experiencing stress from work or relationships or family or finances or fill in the blank, whatever you want to put in there,
life,
that affects your body. And so when you look at that, my job is to identify where that's coming from, direct the treatment, or refer out to where somebody needs additional treatment and supportive care so that we can clear out those areas and they can go back to living their life healthy.
And it goes back to the idea of treating the underlying cause versus treating the symptoms and the things that somebody is like initially complaining about or showing up with.
Yeah, and that's a great point. That's probably one of the biggest differences and maybe misunderstandings about chiropractic and versus medicine. And medicine is great to relieve symptoms, but it's like putting a Band-Aid on it. If the smoke alarm in your house is going off, you don't go take out the battery of the smoke alarm. You're going to go find out where the smoke is coming from because it's probably a fire. So in that same analogy, we get bombarded with advertisements to take these lotion, potions, and pills so that we don't feel whatever symptom that we're feeling. But that's not addressing the cause. That's just covering up the symptom. So in chiropractic, we look to find out what is actually causing the problem. We say doctor of chiropractic, DC, actually means doctor of cause.
I love it. Doctor of cause. Like, and it's so true. And that's really, I mean, especially when it comes to nutrition and everything I focus on. I mean, it's the underlying stuff, and the stress and everything. It all goes together.
Exactly.
All right. So I want to ask you for a second about the pediatric stuff.
Yes.
So how young of kids have you worked with? Like, what's too young? What are the conditions and complaints that they show up with versus adults? Is it really just all the same? And is it better to start when you're a kid? Like, would we all be 3 inches taller if we started seeing you at 5 years old?
So we have an expression, as the twig is bent, so grows the tree.
Okay.
So when is a good time to start chiropractic care? Well, ideally when a woman becomes pregnant or even before she becomes pregnant, because we help them throughout their pregnancy to maintain a healthy pregnancy and have an easier and shorter and relatively pain-free labor and delivery. Also maybe preventing the baby from going breech. But once the child is born, I've seen babies hours after they've been born. My own daughter was adjusted, a few hours after being delivered because we wanted to make sure, even in the best circumstances, childbirth is a difficult process.
Right.
If there's any kind of pulling on the baby, that can be traumatic. But under the best of circumstances, you want to have the child checked as early as possible. Now, what are some symptoms that children might be coming in with? Well, one of the big things is ear infections, right? Ear infections are a major problem among kids, and the typical treatment is to just give them antibiotics. Well, again, going back to what we said before, that's treating the symptom, not the cause. What we found is that in the upper cervical area, up near the top 2 bones of the neck, if there's any sort of stress in that area, it's going to close off the tube, that eustachian tube, that drains the fluid from the child's ear. And there's fluid accumulating in that's what creates the infection. So again, the antibiotics go to kill the infection, but they haven't corrected what's causing the fluid to accumulate in the first place. Chiropractic can release that area, open up that tube, the fluid drains, and now you don't have an opportunity for infection to occur. So there's all kinds of things that kids can benefit from.
So interesting.
At an
I
early
remember
age.
my cousin as a kid had tons of ear infections, and then he got tubes in his ears, and then it was,
It's a cascade. It's a cascade, yeah.
So what do you say to people who are like, I don't like chiropractors. I don't want to have to go see someone every week to be able to function, or like my body then relies on it and, whatever.
Well, people say I don't like chiropractors. I mean, we're nice people.
Right.
Generally speaking, we're really, we're friendly, we're warm, we're lovers, we're givers. But I do hear that a lot. I don't want to go to a chiropractor because I don't want to be addicted. Addicted to what exactly? I'm not sure. Maybe feeling good or being healthy. I mean, it's like eating right or going to the gym. You don't want to be addicted to those things, did you?
Right.
But, really what we try to do is whatever the person's coming in with is to identify what the cause is, and then get them feeling better and functioning properly, and then give them strategies that they can then maintain their health on an ongoing basis. We don't want people reliant on chiropractic. We don't want people relying on anything. I like people to be self-reliant. That's ultimately the goal.
Amen.
But stress always comes into life. We can't avoid stress. It's inevitable. But it's how our bodies and how we process stress and respond to it that's ultimately going to determine how healthy we are. And if it accumulates into specific areas, the neck, the back, you're gonna have problems. If we can maintain that and keep that from bottling up anywhere, you're just gonna live a happier, healthier life.
Right. So what's like 1 or 2 things that we should all, I hate the word should, that we all could be doing right now, maybe even before we come see you or a chiropractor in your neighborhood, to have better, more proper function?
Excellent question. I mean, it's basics, right? I mean, health is so basic. So eating right. I mean, that's simple, right? I mean, we all know that. We may not know how to do that, so we want to come to an expert, like yourself, to get some advice. That's why we're here. We want to go to somebody who's qualified in nutrition, in and how to eat properly, so that your body can ultimately function well. Drinking more water. Most people don't drink enough water, right? I mean, you probably see that all the time. Exercise. Movement. If you don't use it, you lose it.
Yep.
We are increasingly in a sedentary lifestyle. So getting outside, and it doesn't mean joining a gym and paying a trainer thousands of dollars. Walk a little bit. Take the stairs. Park at the far end of the parking lot and walk in. There's so many opportunities to move. That's so much of the equation right there.
Yeah. I think I was talking about this with somebody the other day, just the importance of movement in general, especially as we age. Continuing to move your body and have that functionality.
Yeah. If you don't use it, you lose it. That's the bottom line.
So years ago, I had lower back pain. Turns out it was like a bunch of stuff in my hip. And the physician I went to was a chiropractor, and he practiced active release techniques. So what are sort of the different specialties or types of chiropractic care, and like when would I want to go to somebody who specializes in each? Or is you just pick your chiropractor and you go to that person all the time?
That's another. You got some really good questions, Jen. You're very good at this. So there are a myriad of chiropractic techniques out there, and that's one of the interesting things about chiropractic. It's an art, and chiropractors practice in different ways of expressing that. Some using an active release technique. Now, a lot of different practitioners, not just chiropractors, use active release technique, and that's sort of a technique that's been very well marketed. You ultimately want to find a chiropractor that you like, that you resonate with, that you appreciate their touch and how they care for you, because there's many different styles, and some of them are more gentle and more passive, and some of them are more active, and ultimately you just want to find the one that works best for you.
How do you know?
Everybody has an innate sense of what works and what doesn't work. And if there are flags going off, if you have, bells going, doesn't feel right, then maybe you want to keep looking. Feel right. Yeah, you want to keep looking.
Okay. So since not everyone has you near them, right? And we were just saying, kind of use your spidey sense to some degree to choose your chiropractor. But what else might someone ask when interviewing a chiropractor, or want to look for like in their credentials or something in order to choose somebody?
Good question. So the first thing is probably, ask a friend for a referral.
Sure.
That's always the best one. Somebody else who who's had a good experience. You want to make sure they're licensed. Chiropractors are licensed through their different state boards, things like that. Just maybe ask them about their philosophy, about how they look at life, how they treat things. Some chiropractors are more pain oriented. They'll come in for a specific issue. They'll treat you for that specific issue. Once the pain has gone away, they'll send you on your way and come back when next time you need me. Other chiropractors are more wellness. We call them full spectrum chiropractors. They're more interested in your overall health and well-being, understanding that symptoms are the last thing to come. Pain is usually the last thing to manifest itself after a problem's been brewing underneath for quite a while. So you want to kind of get an understanding of what their philosophy of life is, of what their philosophy of the human body and health and healing is, and then align yourself, with what you feel.
Got it. So even in that respect, like cost-wise, I mean, I know there's a range and so much of it is geographic, and I suppose with any specialty, right? Like price is not necessarily an indication of experience, but sometimes it is. Like how do you know if you're like being taken to the cleaners for,
Yeah, so good question. So chiropractors, we do take health insurance. By and large, we're covered by most major medical insurances, Medicare, even no fault and workman's comp, and Department of Defense. So a lot of times, there is insurance that will cover it. I think probably a flag to maybe look for is if anybody tries to sell you a package of adjustments over time. This is kind of a thing that's not been a great thing for my profession, is to sort of box people into a certain care plan for a certain period of time, predicting the future, if you will. I'm not a big fan of that. It's sort of a let's take a finite approach. Let's work with it, because ultimately, if it doesn't work or the patient needs to see somebody else, it's our responsibility to make sure that they get referred to the proper place. We say chiropractic first, medicine second, surgery last. We obviously want to prevent surgery, but sometimes it's unavoidable. Sometimes there's a limitation of matter, the injury's too great, and it's just chiropractic has a certain limit to what it can do. So you kind of want to make sure that you're not getting boxed into anything that you can't get out of. It should be free flowing.
Yeah, I like that. Before we move on to some off-topic questions, is there anything else you think people need to know or understand about chiropractic care that we haven't really covered?
That's a good question. So I posted recently on my Facebook page. It was just realized it was 20 years ago this month that I graduated from chiropractic school, and I posted a slide about a comparison of classroom hours between the chiropractors and medical doctors. Yes, and I got quite an interesting response from an old classmate of mine in high school who's a medical doctor, and she's gone on to achieve amazing degrees and specialties. But I posted that really because I think it's important for people to understand the education of a chiropractor. Chiropractors are doctors of chiropractic, DCs. So we go through extensive training and learning about health and human physiology and how the spine functions and biomechanics and nutrition and exercise. Again, all in the context of natural health and healing. I don't think a lot of people realize that the length of time. When we went to school for 4.5 years, we have clinical training, we pass national board exams. One of the other things that might be interesting to note, and this is kind of an interesting sort of off-color maybe way of saying it, people are afraid of chiropractors. They think it's dangerous.
Right.
And I always bring up my malpractice insurance. Every healthcare provider has to carry malpractice insurance. And everybody knows that the higher the premium, the more risky whatever it is the procedure. My son is 17 years old. His driver's insurance is astronomical, right? Because he's a 17-year-old boy driver. Whereas, my a 55-year-old female is just because the likelihood of him getting in an accident is higher. So that being said, I'm happy to say that my malpractice insurance is about $3,000 a year.
Wow.
Yeah. And you contrast that with any medical specialty, they're paying tens of thousands, some of them upwards of hundreds of thousands of dollars because what they do is risky. So chiropractic is safe. Even the cervical adjustment, we screen people to make sure that they are able to receive that care. And, and when necessary, if we need to refer out, we'll refer out.
Right. And I think there's something, you talked about this a little bit before, and I say it all the time. I mean, everything in the body is connected. And so if you think about that, what you're focused on is like the central nervous system and that everything comes from that, then you have to know about the whole thing.
Yes.
You can't. I think it's one of my pet peeves, and this is sort of a tangent, but like in the medical world, everything has become so siloed. And like you were not healthy the day before a heart attack.
Yeah.
And just because you've been diagnosed with heart disease doesn't mean that your liver and your kidneys and everything else is totally fine. Like your diagnosis is based on the organ system that failed first.
Totally.
And so anyway, that's sort of a tangent, but I get it and I appreciate it. And so I think it's important for everybody to realize.
Yeah. I mean, it's good to, chiropractic. I think the other thing is that people don't think they need to go to a chiropractor if they have no aches or pains or symptoms. And the fact of the matter is a good chiropractic checkup is a good thing. Like you'd go to your dentist or your OBGYN, right? You don't just go when you have symptoms. You go ahead of time. You take your tires in for rotation and your oil change in your car. I mean, people take better care of their cars than they do of their bodies,
And in New York City, our bodies are our vehicles.
For sure.
Exactly.
Exactly.
And it's so interesting too, because, it's that idea of preventative care. And I always say to people, pain is, as you were saying, sort of like a last resort. Like pain is the loudest way your body can communicate with you.
Yeah.
So if you can notice something before it gets to the pain point.
Exactly. Yeah. If your head isn't turning one way, if you have difficulty bending, if you're taking an exercise class or doing some sort of activity and you're having a restriction in a particular, that's a sign. That's a sign that something's not working. So you can wait until the pain becomes, gets your attention, or you can go take care of it ahead of time.
Yeah. So the moral of the story, guys, is everybody go find a chiropractor.
Go find a chiropractor. Yes.
All right. So our off-topic questions that we ask everybody who joins us.
All right.
What's the best thing you've done for your health this week? And what's the naughtiest thing you've done related to your health this week?
So the best thing I've done for my health this week is I saw this wonderful movie on Netflix called The Game Changers, which I think is everyone's talking about. And the crux of the movie is to move towards a more plant-based diet. And I've done that for the last about 6-8 weeks. I haven't had any chicken, turkey, or red meat, much to my wife's chagrin because it makes cooking dinner more difficult. But I feel great. I have great energy. My digestive system is working fabulously. So I would say that's the best thing that I've done for my health recently.
All right. And what was the naughtiest thing?
The naughtiest thing is, I just, I'm a human being, and I do have an acquired taste for bourbon, and I like good bourbons, and I play in a rock and roll band, and those two things just kind of go together, rock and roll and drinking bourbon. So we had a gig on Saturday night at a club, and afterwards we went back to my friend's house and had a couple of bourbons. So.
Nice. I respect it.
Thank you. I'm human.
Right. All right. If you weren't a chiropractor, what would you do?
Wow, if I wasn't a chiropractor, what would I do? I think I'd probably like to play music. It's become a recent hobby and passion of mine, and I really enjoy that. So I would love to do that. I will just, before I go out, the second thing I'd like to do is do some public speaking, which is an area that I'm moving into.
Yeah.
I'm going to be doing some more professional speaking. Yeah, it's a lot of fun.
Awesome. All right, your favorite book on any topic, fiction works, anything other than your area of expertise?
My favorite book, I think I would have to choose, the first one that comes to my mind is a book called The Tao of Pooh. The Tao of Pooh, T-A-O, for those of you who may not understand that. T-A-O of Pooh, and Pooh meaning Winnie the Pooh, of childhood fame. It's a wonderful book by Benjamin Hoff that uses the characters of Winnie the Pooh to articulate and explain how Taoism works. And I found that that whole philosophy to be really great. I
feel like I read, is there one with Piglet too?
The Tao of Piglet.
The Tao of
Followed
Piglet.
up that one.
Yeah, so I read the Tao of Piglet. I gotta go back.
The Tao of Pooh is better.
All right. If you could cure one ailment, disease, sickness, symptom, what would it be?
If I could cure one ailment, sickness, or disease, it might be depression.
Yeah.
I just find that there's people who suffer a lot from depression and mental illness, and I don't think that gets enough attention and enough respect in our society. And I think that if I was a way that I could help people to be happier and more self-expressed, and overall, I think that would be it.
I love that one. Nobody's really said that. I love it, and I agree with you. If you were a superhero, what would be your superpower?
Oh, God. I guess I would probably want to fly.
Yeah, mine's teleport.
I think, I'd want to fly like Superman. That seems like a really cool thing. I always imagine what it would be like to be an eagle, soaring high in the mountains and just kind of floating on the currents. That seems like it would be kind of cool.
That's awesome. All right, your biggest pet peeve.
Oh, God. I can only get to pick one.
Right, I know.
I think since we're in the holiday season here in New York, and I just experienced this last night and probably every day as I walk through Midtown Manhattan, is, the throngs of tourists who just like to meander down the streets and stand in the middle of the sidewalks while, us busy New York, self-important New Yorkers are trying to get from A to B in the quickest time possible.
Right. I always say to people too, like, you live in the suburbs, okay? Like, this sidewalk is the equivalent of your freeway. Would you stop your vehicle in the middle of the freeway?
That's a very good point. That's a very good point. Yeah, that would probably be my biggest pet peeve now.
I get it. Clearly, I get it. Right. All right. In your opinion, what's the next frontier in wellness?
The next frontier in wellness. Well, again, I was just reading about this and I'm learning about it. I don't know a lot about it, but there's a lot of talk of the CBD. CBD seems to be the topic of the day. Cannabis in general, legalization of marijuana in general. I think there's a lot of benefits that are beginning to be uncovered now in a variety of different ways. It's a naturally occurring plant and herb. Mother Nature created it. We're now just only beginning to explore, expose, extrapolate, the chemicals in there and seeing how they interact with our own body's endocannabinoid system, which we have inside of us, that CBD works with to help our bodies heal naturally. So I think this is really exciting, the research that's coming out now. And I really hope that it continues along this track, because we know that drugs have a place. They've certainly come a long way, but if there's any way we can activate the body's own healing system, and if it's through CBD or something like that, I think that's the direction it's going.
Yeah, maybe we'll have you back to talk more about it, because I do want to talk about, full spectrum hemp versus CBD versus,
I'm doing a lot of reading and research about it, because it's coming out fast and it's a little confusing. There's a lot of confusion out there, and I'm trying to sift through the reliable sources and the the hype and the hoopla and the promotion and advertising of it for monetary gain.
Exactly.
It's not easy. So it's a little bit of a chaos right now, but it's going to settle down.
Yeah.
Yeah.
So, and we'll be here to clear it up.
Cool. I look forward to that.
Yeah. Well, I'm thrilled to have you here. Thank you again. Tell everybody how to connect with you and find you and all the things.
Well, thank you, Jen, for having me. This is the first time I've done something like this. You make it seamless and effortless. You're very good at it.
Thank you.
So thank you. Best place for people to find me on the web, probably drrobertshire.com is probably where you can find all my information.
Excellent. And you guys will find, how to spell Dr. Robert's name and all that stuff in the show notes. Of course, I want to remind everybody about our new membership program. So keep your eyes peeled for all of those details. As a reminder, I'm your host, Jenn Trepeck. You can find me on Instagram at Jenn Trepeck. Our Facebook page is also at Jenn Trepeck. Our Facebook group is Salad with a Side of Fries podcast. And we want to hear from you. So let us know, what's working for you, what you're looking for, what questions you have. One more time, guys, thank you again, Dr. Rob. And we will be back next week. Thanks again.
Bye-bye.
Well, friends, that's it for today's episode of Salad with a Side of Fries. Congratulations for making yourself and your health a priority. Thanks so much for joining us. Be sure to click subscribe or follow on your favorite podcast platform. Share us with a friend, and we'll be back next week. Always remember, you deserve it, and you are worth it. Happy healthy.